Obesity in children should be addressed as sensitively as possible, because an obese child is a very unhappy child and needs a lot of understanding and consideration. I'm afraid we are letting our children down tremendously by not understanding their situation and putting in all the programs which are needed, which I've seen here today in Londonderry, all the programs which will actually help them get out of their predicament and into a healthy lifestyle.
We'd seen so many young people coming from the chip shop, you know, with brown bags full of grease dripping, walking by our office, and we did everything we could in terms of exercise and stuff and working with the young people, but we realised, you know, that wasn't going to work. We need to work with the families too. So this project gives an opportunity to do that.
And they take families through the programmes, they introduce them to the programmes, they initially assess them on their health and well-being, and they have to help them set family and individual goals to progress through the programme and support them then after the programme in their local networks.
Just to see people eating together and playing together, as it, you know, young, older parents with very young children, and all being interactive. And then we have such a range of activities for engaging people, you know, in outdoor activities, whether it's cycling or swimming or walking or other club-based activity.
There have been very positive changes in relation to people's, both families, parents, children's knowledge in relation to food, trying foods that they have never eaten before, certain fruits, certain vegetables, and also the skills that have been learned in relation to cooking and practical skills, I suppose, both for parents and their children.
We knew that there was a growing epidemic of obesity in the island of Ireland. Both our strategic directions, both north and south of the border, was indicating that 1 in 4 children were obese in coming into school. And also that we had an adult population whereby obesity was becoming bigger.
It's been very positive and they've been very favourable results. We've seen children reduce their waist measurements by up to 4 centimetres. We've seen children lose weight. We've also seen children grow into their own height and weight in their natural age range. We've seen families take on new healthy lifestyles, reduce their consumption of high fat or high sugary foods, increase their production of fruit and vegetables, and increase family activities, and for children to increase their physical activity levels as well.
1 year into the project, we already are at the stage where we know that the waist circumference of children, the BMI-Z scores have been affected. We know that physical activity levels have been increased. We know the children are spending less time watching TV, but it's not just about the children, it's about the family. And the robust evaluation from the University of Ulster really backs up what the children and the families are saying.
I don't believe this work can be done unless you have a dedicated team of people who are appropriately qualified, yes, but also are committed to the work that they're involved in. And we're very fortunate that we have a very good pool of facilitators, well trained in the whole range of physical activity, diet and nutrition, etc., but also with the kind of commitment to the community that is essential for the delivery of these programs.
But we need to start looking at, you know, how we utilise the money we have better. How do we utilise our resources better? And this is one way of doing it.
In line with CAWT practice, cooperation working together, the CAWT project board is made up of CAWT partners, health and social care organisations on both sides of the border region, and also additional members to ensure that the project board is fit for purpose.
Also, I think it's very important that we sustain the work, because I think while the evidence is overwhelming that the need exists, I think the level of investment is really disproportionate to that need, and we need to have this work invested in if we're going to turn this huge tide around and get people to adopt more healthy lifestyles.
It has developed a model, you know, that can be sustained and that can be replicated. And I suppose our role, as the project board, is to try and ensure that that can happen.
Families are now talking to each other about other things, about education and that. So we need to pull those strands together, like say the education, you know, the mental health work, pull those together and say, okay, we can take those part of those elements and encompass it in this Up For It project.
Particularly looked at the title, Up For It, And it gave me the idea that this was a wonderful generic title for something which a lot of other programmes can be part of. And I would like to see Northern Ireland really take that as its own and say, we can do it in Northern Ireland, you can do it anywhere else. We've got the system, we'll write the book for you and you do it.